A frightening and completely avoidable side effect of surgery that's becoming an increasing reality in Canadian hospitals. Of course, medical procedures come with some risk, but a new report shows one of them is a careless error in the operating room. 553 objects, things like sponges, needles, clamps, even scissors, were left inside patients after surgery between 2016 and 2018, a 14% jump over the last 5 years. CTV's Vanessa Lee on the medical mistakes.
Clamps, tweezers, even a 33-centimeter metal plate. They're just some of the surgical tools forgotten in patients, leaving them in excruciating pain. This metal device was left inside a BC woman's body for 10 long weeks after she had an emergency C-section.
I could see that there was wires running up inside me, and I was so afraid to actually remove it because I wasn't sure if it was attached to my insides. I pulled out a medical apparatus I'd never seen before.
Across the country, there has been a sharp increase in this type of medical mistake. In a new report by the Canadian Institute for Health Information, Quebec had the highest rate. The data only notes how often items were left behind, not how or why.
The consequences of this kind of event can be severe. It's a never event. You want to drive it towards zero.
Canada lags behind other wealthy countries who record these statistics. An object is left behind 9.8 out of every 100,000 hospital discharges. That's more than double the average rate.
There's lots of checks and balances, highly trained professionals working in a very stressful environment. So sometimes these things do go unnoticed or unmissed or fall through the cracks.
Though health experts point out comparisons are difficult. The US, the UK, and Australia don't track such incidents.
We have really good data in Canada to count these things, and that's a good thing because it means that you can put improvements in place.
But Laura Jokinen believes there is a systemic flaw. A year later, the health authority has not taken responsibility for what happened to her.
If they aren't taking accountability, how are we going to make any positive changes to our healthcare system?
Patient advocates say everyone has a role to play in improving the system, and Canadians should feel empowered to speak up and ask questions when something doesn't look or feel right. Lisa.
All right, Vanessa Lee on the disturbing statistics.